Hi, I'm Lauren Muhlheim, and I'm the author of When Your Teen Has an Eating Disorder, Practical Strategies to Help Your Teen Recover from Anorexia, Bulimia, and Binge Eating. This book is designed to help parents who are helping a teen to recover from an eating disorder. And today I want to talk to you about how to interpret a weight chart. So this is really helpful when determining a recovery goal weight for a teen in recovery. At least in the US, most pediatricians at every wellness visit will plot your child's height, weight, and BMI on curves. And these can be really helpful to you to look at in terms of where your teen is in terms of recovery. And you can interpret any of the charts, the height, the weight, or the BMI. Today I'm going to focus on a weight chart. It's important to keep in mind that your child grows in a pattern and at a weight that is unique to them. So most children grow along a similar percentile line for most of their lives. And that is probably normal for that child. So some children will grow along the 25th percentile, some will grow along the 75th percentile, and some will grow along the 95th percentile, and that can all be normal. It's also important to mention that the height and weight percentiles do not necessarily match. So it could be perfectly normal to have a child who is at the 75th percentile for weight and the 25th percentile for height. And that is why it's so important to look at your child's unique growth pattern when determining a goal weight. It's much more reliable than using population averages or BMI ranges. So today I've got a sample weight chart of Stacy. And if you look here, we're going to look mostly from about age 3, because the earliest years are not as reflective of where a child's growth really is. They're more related to prenatal factors. If you look here, from about 3 till about age 8, Stacy's weight is centered mostly along this dotted line, which represents the 50th percentile. It's closest really to that line. And then if you look here at age 10, she has clearly fallen below. Actually, starting around 9, she started to fall below her normal trajectory. And we could say here that she is weight suppressed. Now, if you were looking at her at age 11 and trying to determine where she should be in terms of her weight, you would simply look at age 11, go up to her 50th percentile line and go across and see that she should be about 80 pounds. And she's less than that here. And you can also see her projected weight over time. So if you're thinking about a recovery weight somewhere in the future for where she should be at age 12, you would see where the 12-year mark crosses her percentile line, and it's quite higher. It's at least 90 pounds. And you can see in this example of Stacy that she, in fact, did return to her own trajectory by about age 13. So I just want to reiterate that the example I have shows a child whose percentile line happens to be the 50th percentile. That is really a fluke, and just that this is the example that I have. So it would be just as normal to have a child who was centered around one of the other trajectory lines. And that's why I encourage you to get your child's growth records from your pediatrician. And if you are not able to, and you have heights and weights, you can plot them yourself. And I've got some resources in my book for how to do that. So I hope this has been helpful, and I encourage you to check out my book, which is available on Amazon and via my website, Eating Disorder Therapy LA.